Hi, and welcome to Traditional Health Works. I'm Catherine Stewart, and I'm going to talk about my specialties, my practice, and also how to know if acupuncture is working for you and how many treatments you're going to need. So as far as my practice, part of what I do is educate people, as you've probably already figured out. So I have a lot of information on my site about things you can do at home and how I can help you know how to do things at home. When I work, I see one patient at a time, except in a community care clinic, which case you'll know you're coming to that, so you won't be surprised to see other people. I have worked in many multi-disciplinary clinics. I've seen many patients an hour. I've worked all different ways. And at this time in my life, I like to take the time and the focus and the attention to just see you. If you want me to stay in your room with you while you have acupuncture, I'm happy to do that. If you want me to leave so you can meditate, I'm happy to do that too. It's really up to you and what you're comfortable with. And my specialties, all of us are trained in what I call general medicine, just like a GP is trained to see most things most of the time. Some acupuncturists have become specialists and they only see one thing, like backs or whatever. So I do see everything. I love to see everything, and I love treating children and pregnant women and adults and men. But there are a few things that I do sort of specialize in. One is orthopedic acupuncture. I had a lot of back pain and trouble when I was on crutches, and so I've had to have a lot of different treatments, see what works as far as acupuncture, and also see what works as far as other body workers, and see what works as far as day-to-day activities. So those are things that I will be happy to pass along, because back pain is the number 2 reason that people visit doctors in this country. It's an epidemic, and it really has a lot to do with what we do on a daily basis: sitting, bent over, whatever. The other thing that I see a lot of is allergies, whether it's food allergies or environmental allergies, and also colds and flus and lung things like bronchitis. A question I get a lot is, how do I know if it's working? Well, the first answer is you get better, right? I mean, that's obvious. But sometimes with chronic pain or chronic diseases, it's not so apparent. You don't get one treatment and jump up and you're cured, although, I have seen that, to be honest. So what we look for is, are you even a little bit better? Maybe the frequency is better. Maybe you are 100% better for an hour or a day. Or maybe if the frequency was the same, maybe the intensity was better. You weren't as tired, or you weren't as much in pain, or your allergies weren't as bad. I don't want to see you if I'm not helping you. So it's hugely important that we both know you are getting better. Sometimes if we're not sure, I tell you to take a break. And if you're worse without it, then we know we're on the right track. Most people do feel something with one treatment. If not, give it at least 2 times. And sometimes it's because I'm not the acupuncturist for you. Maybe there's someone that does something better. I know that's hard to believe, but actually we all have our specialties. So some things that have been there a really long time are going to probably take a long time to get rid of. Sometimes acupuncture will work all by itself. That's all you have to do. Let's say for allergies, you come consistently until you don't need to come as often. You come less and less until you don't need it anymore. Sometimes with allergies, we got to talk about your diet and get you off sugar and dairy and gluten. I mean, it just depends on how your body responds. Some people are very lucky. A few treatments, they're good to go. Some people, it takes a lot of work at home and coming and in my office. But I will always work with you, financially and otherwise, to make it so you can come, get better, and move on. See me once in a while if you need to, if you have a little flare-up. So in a nutshell, 1 to 10 treatments is average for most things. Takes a little longer if you've had it longer, but I have seen people respond quickly, and that's what I hope for everybody. Believe me, there's enough people in the world, so if I want to get you better and get you out of here and see you for a tune-up or something. So if you have questions, please feel free to email me or call me, and I look forward to helping you. Thank you.